Former top U.S. infectious disease official Dr. Anthony Fauci, is recovering from home from a West Nile infection. As Jared Hill reports, Dr. Fauci was hospitalized for nearly a week after contracting the virus.
West Nile virus infections are the leading cause of mosquito-borne disease in the United States. Many areas are seeing cases, including New York City, where the health department is spraying from dusk to dawn. Former federal health official Dr. Anthony Fauci is recovering at home after being hospitalized with an infection. CBS News chief medical correspondent Dr. John LaPook spoke with Dr. Fauci over the weekend, who says an infected mosquito probably bit him in his backyard.
About 2 weeks before that, he had just started not to feel very well, mostly fatigue, and then the fatigue really increased. He developed shaking chills like he said he's never had before in his life, fever, and he was hospitalized for about a week.
People at risk for severe illness include the elderly and people who are immunocompromised. West Nile virus infections cause no symptoms in most people, but others can develop fever, body aches, joint pains, and a rash, according to the CDC.
And about 1 in 150 people who get infected get a more serious form that involves the central nervous system. You can get inflammation of the brain and the membrane that lines the spinal cord, and that's a much more serious situation there.
So far this year, more than 215 cases of West Nile have been reported in more than 30 states.
It's a mosquito-borne illness, so you try to avoid mosquitoes. Dawn and dusk is when they tend to bite. Wear clothing that covers your skin. You can have insect repellent, and then get rid of standing water, because in the standing water, that's where the mosquitoes can multiply and breed.
The CDC says there is no treatment for West Nile. Rest, fluids, and pain medications may help alleviate symptoms. Jared Hill, CBS News, New York.
Also this morning, a voluntary evening lockdown is issued in parts of Massachusetts because of a potentially fatal mosquito-borne disease. It is called Eastern equine encephalitis, or EEE, and the decision to do this came after the first humane case was found there since 2020.